Hands on Hartford. Standing here with me today to highlight this important crisis with the SNAP benefit cuts is U.S. Senator Richard Blumenthal, Attorney General William Tong, Elena Trueworthy, Commissioner of Office of Early Childhood, Penny Parks, a resident from Fairfield, Connecticut, and Governor Ned Lamont. As many of you know, with this federal government shutdown, nearly 400,000 Connecticut residents are struggling to buy food. And of those, about 40% live right here in Hartford. For 56 years, Hands on Hartford has been committed to meeting the basic needs of our community through a variety of programs, and most importantly, through our community pantry. We continue to see the need grow. We see our lines getting longer, and we have issues trying to keep our shelves stocked to meet the needs of our neighbors. Our mission remains clear, and it's to serve our neighbors in need, but we can't do it alone. We need your continued partnership and support to meet this moment. I also want to express my deep gratitude to Governor Lamont for releasing $3 million to Connecticut Food Share. We are a Connecticut Food Share partner, and we will receive a credit, and that will help us to continue to keep these shelves stocked to serve all of our neighbors that are going to come to us starting Wednesday and through the rest of the month in November. Together, we can ensure that no one in our community goes hungry. Thank you for standing with us in this important work. And now I will introduce U.S. Senator Blumenthal.
Well, thank you to you and your team at Hands on Hartford for helping to fill the gaps that have been created by the federal government and meet the needs of countless people. Organizations like food pantries and others around the state have been struggling with lines that I have seen myself, most recently on Friday when I visited the St. Vincent de Paul in Middletown and spoke to folks there and saw the lines of people waiting for food, people who've never asked for anything before, and people are really hurting as a result of this shutdown. But we are very fortunate in Connecticut to have a governor who has sought to meet that challenge, and that $3 million is a fraction of what's needed, but he is stepping up along with the Attorney General, who has taken legal action that is having results. But let's be very clear. President Trump is seeking to maximize the pain, inflict additional suffering on people as a result of this shutdown, to put more political pressure on Democrats in Congress, but also simply to inflict pain. He has stopped the SNAP program, even though he has both the authority and the funding to provide it. The Department of Agriculture initially said it was going to fund the program, and then in October decided no, it wasn't. And now, in part as a result of the great work done by our Attorney General, 2 courts have told him that he must fund SNAP. He has said that it will be his honor, in quotes, honor, when he has appropriate guidance, as he's put it, from the courts. Well, he has appropriate direction now. There's no question about it. Today, this week, those EBT cards are operative, and people in Connecticut need and deserve the SNAP funding. The courts have told him not only that he can, but he must. And the reason is, quite simply, he has a contingency fund of $5 billion. He has additional money from tariff revenue. It's there to be used for exactly this purpose, and the law is clear. He has an obligation to do it. Now, there are other programs that he has sought. He's furloughed and fired federal workers. He has, in fact, said that those furloughed workers may not receive back pay, even though it's the law that they deserve it. He has threatened programs like LIHEAP and Head Start. They are at risk. the policy of inflicting pain with the pretext of this shutdown must stop. And I hope we'll have bipartisan agreement, at least on that basic fact. There is good news in Washington. There seem to be conversations beginning aimed at ending the shutdown. They're only beginning. But again, Trump could end this shutdown this afternoon by simply coming forward and making a commitment that the health care tax credits will extend beyond the end of the year. That is what we have insisted on as a commitment, and Trump is an essential player. He must come to the table because the majority leader of the Senate and the Speaker of the House will make no commitment, at least no commitment that's worth anything, without the President being at the table. And right now, the people of Connecticut are making judgments about whether they can buy health insurance through open enrollment. Literally today, they are making judgments about whether to buy health insurance. And many of them are turning away because they are finding the premiums have doubled and tripled. They can't afford it. That's why these tax credits are so vital and why we are insisting on them right now. People can't afford to get sick on Donald Trump's timetable. They need these health care tax credits right now. And Donald Trump could end the shutdown, guarantee the tax credits for the people of Connecticut and all around the country simply by coming to the table and making that commitment. It is within his control, and his insistence that he's above it and won't be involved is really a violation of his public trust. Let me just conclude by saying we're going to continue to fight for the people of Connecticut. We're united as a delegation, and I'm very proud that our delegation has stood firm and strong for the people of Connecticut in the midst of this shutdown. The indications that maybe there's a thaw are promising, but until it happens and until Donald Trump comes to the table, there can be no assurance that it is. And let me now turn it over to the Attorney General, who has gone to court on this issue and on so many others to make sure that the people of Connecticut are protected.
Thank you, Senator. And more importantly, thank you, Janet, and thank you to your team for doing everything you can under these circumstances. Thank you, Governor, for stepping in immediately. And I want to echo what the Senator said. The entire delegation is united on this. I've talked to most of them, and everybody's doing their part and fighting as hard as they can. But standing here this morning, you have to ask yourself, what the hell are we doing here? I mean, honestly, we should be here feeding people right now. We should have clients, customers, the people that you serve, getting food so they can feed their families and children and going on with their day, and most of them to go to work, right?
Yes.
Because many of the people that we serve are the working poor and that people who need some help. But instead we're here because the President is deciding to use his authority to make people go hungry. And this is so counter to law, but also counter to the way that Americans have always treated each other. This has never happened before. In what would have been the second longest shutdown, they funded SNAP, and people got food on the table for their children because USDA and the President and the federal government have the ability and the authority to fund it, and they're choosing not to. This is, by the way, SNAP is mandatory. There's no discretion whether SNAP gets funded, right? SNAP is mandatory under law. Congress has directed the President to feed the American people, and more than 100,000 children in Connecticut and almost 400,000 people in Connecticut, so many households are supposed to be getting food assistance right now. And instead, what the President is doing is seeking to gain leverage in a political stalemate, right? He's seeking to serve his political agenda by willfully and intentionally making children and families in Connecticut go hungry. He is weaponizing hunger and health care because the Affordable Care Act and federal subsidies for the ACA are also at issue, among other things. But it is beyond unconscionable when the president has a clear legal duty to fund these programs and to provide food to people that he is choosing to weaponize food and medicine, and to turn hunger and illness and sickness and the need for health care against people and their families. And as I said the other day, to starve his political opponents and the people that he does not like into submission. And so today, what's happening today is in 2 federal courts, one in Rhode Island and one in Massachusetts. The Rhode Island case is a private party case in which some cities are parties. New Haven is part of the Rhode Island case. We are in the Massachusetts case. That's the state's case. And in both of those cases, USDA is supposed to report back on what they're going to do about funding SNAP. They are under a legal duty, not just under law, but a legal duty as ordered by these 2 courts to fund SNAP, because both courts have found conclusively that the president and USDA and the Secretary of Agriculture have to fund SNAP. The question right now is when and how much. And so both courts have said you have to use the contingency funds. That's about $6 billion. We need $8 billion roughly to fund the entire month of November. So we're $2 billion short. So they at least have to use the $6 billion. Then the question is whether USDA is going to use its discretion, which it has under the Agriculture Adjustment Act, to fund the additional $2 billion. And they have access to other money to do that. So that is an open question. The bottom line is this: by close of business today, USDA must report whether they're going to fund all of SNAP for the month of November. If they choose to fund a partial funding of SNAP, meaning they won't make it all the way to $8 billion, they'll use the contingency funds and they won't close the gap, they have until November 5th to report back on their status and their progress in doing that. What does that mean for people in Connecticut? That means there are people right now in Connecticut who have EBT cards that don't have money on them. That's what it means. There are people who don't have access to food as we speak right now, which is an utter and complete outrage. People should not go hungry in the wealthiest nation on earth, period. But that is what the president is choosing to do. He is choosing to weaponize hunger and health care and medicine against the American people who he has sworn an oath to serve. And so let us hope that USDA comes back today with the right answer, that they're going to cover not just the $6 billion, but the $8 billion, and do the right thing and put foods in the mouths of children here in Connecticut. Thank you.
Thank you, Senator and Attorney General. Next to speak is Elena Trueworthy, Commissioner from the Office of Early Childhood.
Good morning. I want to first thank Senator Blumenthal and the federal delegation for all of your work that you're doing down in Washington, D.C. And also our Attorney General Tong and Governor Lamont. Your tireless work is really giving hope to the people of Connecticut during this critical time. I'm here to talk about the impact of what a stable, healthy nutrition source means for the development of young children and their families. Healthy nutrition serves as a fundamental building block to child development, really ensuring that children in the youngest years, when the brain is doing the most development and during such a sensitive time, is receiving what they need in order to thrive, be healthy, and to learn. We know that access to stable, healthy food allows for enhanced brain development, improved academic performance, and really prevents long-term damage that can occur. Many child care settings play a critical role in helping with providing healthy meals and nutrition through the Child and Adult Care Food Program, or as we better know it as CACFP. With the vision of Governor Lamont, the leadership of the House and Senate, advocates, families, and others, Connecticut passed historical legislation this past session to create the Connecticut Early Childhood Education Endowment. This will help to expand over the years to come high-quality child care spaces where children can receive some of this food and nutrition, along with other opportunities to make sure that they are learning, they're healthy, they're safe, and they're thriving. We will see positive, significant impacts to the early childhood endowment, starting with just this year with approximately 1,000 new state-funded child care spaces to roll out in the upcoming year. But it's important to also note that families really rely on a combination of federal and state support, such as SNAP, WIC, and Head Start, along with health care coverage. It's good news about SNAP and the temporary judge's ruling, but it's not enough. And I also want to thank Governor Lamont and the Department of Public Health for funding WIC for the month of November. This really provides critical supports and healthy nutrition, starting with formula for newborns. As state leaders, we are all working together to do what we can during these very challenging times. At the Office of Early Childhood, our programs, fortunately, are running normally. Home visiting and birth to 3 early intervention has funding on hand to operate through the end of this fiscal year. And Care for Kids, which we know a lot of families depend on for direct services, has support and funding through January of 2026. We'll continue to monitor this very closely. I now want to welcome Karen Pascal. She is Connecticut's Head Start State Collaboration Office Director. Head Start is a critical federal partner to the early childhood system and serves many of our most vulnerable children and families. Karen?
Thank you so much, Commissioner. As Commissioner Truworthy said, as the Head Start Collaboration Office Director, my role is to help connect our federal Head Start programs to state systems and services so they can best meet the needs of children and families they serve. Head Start is a vital part of Connecticut's early care and education landscape. There are 22 programs across the state, including both grant recipients and delegate agencies. They're serving over 5,200 children and their families. These programs are using a 2-generational model of providing early care and education and comprehensive support services for the children and families. Family service staff work directly with the families, connecting them to essential services, including health services and food and nutrition programs. In Connecticut, more than half of the families served by Head Start are SNAP recipients. About 2,800 or 52%. In fact, any family that receives SNAP's benefits is categorically eligible for Head Start services. This was a change that went into effect in 2022 and allows programs to reach more children and families that otherwise would not be eligible for Head Start services. With the federal government shutdown, we've been closely monitoring the impact on Head Start. 2 programs were scheduled to receive their grant awards on November 1st, and they did not receive that notice of award. And during the shutdown, they are unable to access funds while the government remains closed. This could have disrupted services for children and families, affecting parents' ability to go to work or go to school. The Connecticut Office of Early Childhood, with Governor Lamont, is making funding available to help cover Head Start costs and ensure these programs remain open and continuing to serve children and families without interruption. By working together with our federal delegation and at the state and local level, we'll continue to ensure that children have what they need during this federal shutdown. Thank you.
And now I invite Penny Parks from Fairfield, Connecticut to speak.
Hello, and thank you to our leadership in Connecticut, because without you, I'm a mom. We need you guys. I'm a mom of my son Eric is 33 years old. He has tuberous sclerosis complex. It's a genetic disorder, and he has everything: autism, ADHD, seizures, and he lives in a group home sponsored by Ability Beyond. Ability Beyond is mostly funded by Medicaid. To say that I'm terrified is an understatement. I don't know what we will do if the agency has to close down. This can happen to anybody. We were just regular parents, and we had a son with a genetic disorder. But Ability Beyond also houses people with traumatic brain injury. So we're the real people that this affects. Medicaid funding is so important. The credits for affordable health, the direct support staff that takes care of my son every single day, these are not high paid people. These people have to support their families, and these people take care of my child. And it's so important to me that people, regular people in Connecticut, have affordable health care. This just affects everybody. So I want to thank you. Our story is personal, and I have to say our story can happen to anyone. And Medicaid is not about people who are lazy. Medicaid is about people who are disabled. My son is 33 with a mentality of a 5-year-old. And without the supports, I really don't know what we're going to do. So thank you for giving me the time today to tell my story.
Thank you.
Thank you, Penny. Thank you for sharing your story. These are the stories that we need to share. These are real people, real lives. We need to make sure that folks have their basic needs met. Everyone deserves that. I now invite Governor Lamont to speak.
Well, Penny, hearing your story, that's why we're here today.
Thank you.
These are all sort of abstractions coming out of Washington, D.C. Cuts in Medicaid, and don't worry about the WIC and SNAP, and then your story brings home how people survive, need this, desperately need this. And Janet, we're here. We're here for you because you're here for hundreds and hundreds of families who come to Hands On Connecticut. And I want you to know help is on the way. Those empty shelves over there will be filled with fresh produce. Starting at 4:30 this morning at Food Chair, 8 new trucks loaded with fresh produce going out serving hundreds of different shelters all across the state because the need is real. And, we can't wait for Washington. I appreciate this is great. They're finally beginning to talk. I thought those House Republicans were on Ferris Bueller's day off. I didn't know when they were going to be coming back. But they're back, and we need them to do that. But we couldn't wait any longer. It's so erratic coming out of Washington, D.C. When it came to the SNAP benefits, we said, can we just replenish SNAP until the shutdown ends? No, you can't do that. Can we replenish it even if you don't pay us back? No, you can't do that. In fact, we may shut off the EBT card. No, we're going to turn on the EBT card. I mean, the gross incompetence, not to mention the heartlessness, is scary. And it's scary for you and your son. And that's why the state stepped up, thanks to Food Chair and Andrea Barton-Reeves. We got ahead of this about a week ago, started ordering the food, bringing in the trucks, and that's 3 million meals this week. And hopefully, thanks to William Tong and the lawsuits, the feds are going to step up and do the right thing and replenish the EBT cards, which went dark on Saturday. And if they're not, we're there anyway going forward. We're there going forward for WIC because right now there's enough money for women, infant, and children for now, but that could run out any day. We're going to be able to stand up and make sure we're there for you. LIHEAP, it's getting a little colder out there. That's about $70 or $80 million. I'd like to think that will be refreshed when the feds get back, the government gets back. But, in the meantime, I want people to know, to have confidence that when it comes to WIC, when it comes to SNAP, when it comes to, home heating, we're going to be there to support you. And I don't know what's going to happen on those health care. I mean, the idea of jacking up health care and jacking up food costs at the very same time that, Janet, you said the demand is more than ever because of rent and the high cost of food just seems particularly mean-spirited. But here in Connecticut, we're going to do everything we can to make sure that we take care of you. And I'd like to thank the federal government gets back in operation. Sit down with the president, come back from his Gatsby party, and let's take care of people. Thanks, everybody.
Thank you all for being here today at Hands on Hartford. Thank you for being committed to us, our residents here in Connecticut, the city of Hartford. We appreciate everyone uniting. This is what we need to do because, as I said earlier, we need to meet the basic needs of our people. They deserve it. We all deserve to have our basic needs met, so we can't forget about the unseen in our community. Thank you.
Any questions?
Yes. Governor, there's a confluence of things going on. You have the staff suspension, but at the same time, there's been a discussion about what Connecticut should do to offset some of the cuts in H.R. 1, the One Big Beautiful Bill. Can you give us the latest update as to what is likely to be on the agenda next week in the special session that will be regarding setting some further funding aside, intercepting it before it goes into the pension fund?
Yeah, we're going to make a proposal that we set aside money to take care of the cuts necessitated by the shutdown. That's priority number one. We're going to have enough money in place on a bipartisan basis to make sure we can take care of people as long as it takes when it comes to WIC, when it comes to the SNAP cutoff, when it comes to LIHEAP going forward. We'll have time later to see if what we want to do in terms of the big budget busting bill and all the unnecessary cuts are included in that. But right now, my number one priority on a timely basis is to take care of the people who are getting hit and hit hard by this shutdown.
Okay.
Let me just add, part of what we're trying to do is get reimbursement for what the state is having to do with its money as a result of the SNAP suspension. Let's regard it as a suspension. And so our legislative effort, and we actually went to the floor this past week, we sought unanimous consent for a bill that will not only restore funding but also reimburse states for what they are spending to make up for the SNAP shutdown. But, you know, let's be very clear. The federal government has money. Mm-hmm. It's sending $20 billion to Argentina. Mm-hmm. $20 billion to Argentina. It is staging a flotilla of battleships and aircraft carriers off Venezuela at a cost of tens of millions of dollars in preparation for a possible war. And in all kinds of ways, spending money that could be devoted to help people who are in need. And we're not talking about necessarily only low-income people. We're talking about middle-income people. We're talking about working families who are encountering a perfect storm. It is a perfect storm of increasing food prices as a result of these misguided illegal tariffs, increasing premium costs for health insurance as a result of the failure to extend the health care tax credits, and a SNAP benefit shutdown, a government shutdown, a perfect storm that is hitting working families here in Connecticut. And the federal government has an obligation to do its part. Obviously, the state is preparing with Governor Lamont's leadership for a special session, and Connecticut is fortunate because we have a surplus and a rainy day fund, but it shouldn't be on the states to meet this gap. It should be on the federal government. They have an obligation, they have the resources, they have the authority, and the courts are telling them they have the duty.
Governor, when you announced last week this $3 billion, you even had mentioned that it would only be a temporary solution, right, 2 weeks. If this goes on, what kind of money will Connecticut have to put to provide food for Connecticut?
So we're doing 3 million meals this week. That was pretty much what we thought Food Share was able to handle. We can double that as needed, depending on what the needs may be going forward. WIC, we've got reserves necessary to do that. LIHEAP, I think the same way. If at the end of the day there's a deficiency, we've got a rainy day fund that can make up for some of the shortfall. But I think, as Senator Blumenthal said, the state of Connecticut cannot make up for Washington's failure. They've got to step up. They have a legal obligation to provide this funding. We're doing what we can to help people in the meantime.
Governor, there's been a request to set aside approximately $500 million not all money that you need to appropriate now, but it's money that could remain available that would otherwise be locked up in pension funds. So have you settled on a number that will be set aside next week in special session?
Yes,
And what is that number?
to be determined.
So-
I'll let you know tomorrow. But we've got an agreement. We're going to be going forward. We got a special session. We're going to have money set aside to be able to take care of people in need.
You've been urged, I know there was a meeting, the Black and Puerto Rican Caucus met with you Friday, and I observed people approaching you Saturday, urging you to do more, however more is defined. What did you tell the Black and Puerto Rican Caucus Friday regarding what is likely to happen next week in the special?
That unlike most other states, we have a $4 billion rainy day fund to take care of eventualities like a recession, like the federal government cutting off their obligations to people like this. If in addition to that, they'd like us to put $400 or $500 million additional set aside, don't use it to pay down your pension debt, but just in case we have that money in place, I'm willing to do that.
So we're talking $400 to $500 million.
That's correct.
Governor, to Susan's question about, if these benefits continue to be delayed or if they're only partially restored, obviously there's a bipartisan push to create a state substitute for SNAP to keep people whole. Have you made any progress in looking at what other states are doing and if that's possible here in Connecticut?
Yeah, as I was suggesting, it was a bouncing ball there for a while. We have a pretty good idea now. We will be able to use the EBT card. We could potentially do cash on that if this thing goes on a lot longer. I think I told you we could double down on what we're doing with food share, add on additional food pantries, depending on what that need may be.
Can I just
Please.
echo what Senator Blumenthal said? I mean, I appreciate these questions. We've been getting these questions all along. They're fair questions. What is the state going to do? But it's the wrong question because there's one person who can fix this right now, the President of the United States. That we should not be fighting amongst ourselves. You mentioned bipartisan, I hope, but we should not be fighting amongst ourselves as to how we're going to comply or capitulate, right, and live with his unlawful actions. They're unlawful. They're wrong. And there's one person who can stop this right now, and it's the president. And so, yes, we're going to do what we can, but one person is responsible for all this pain and suffering.
For those of us trying to explain what government is doing, with all due respect, sir, these are exactly the right questions we're asking. Governor, how will, if SNAP is resumed, and if there's a decision to go the full $8 billion, will that affect what happens next week in special, or is that sort of a side issue, as it were, albeit an important one?
I think it's a real issue, but when it comes to 400, 500 million set aside rainy day fund, the landscape is changing so quickly. That's not going to be determinative. We're going to be there to take care of people when it comes to food, when it comes to heat, and when it comes to WIC.
And the senator has talked about, again, the very important issue of the subsidies on Affordable Care Act. That is a bigger number. You have said, and the legislators have said, that the state can't replace all that. But is there something that you can give us a sense of as to how much of a subsidy perhaps the state could do, at least temporarily?
Yeah, I'm with William on this. I mean, I can model out each of these eventualities, but get it together. I mean, we've got this, the ACA. It's a really important program. These are all working people. They are often self-employed. The only way they can get insurance is through Obamacare. These subsidies allow them to afford it. I don't think Trump and the Republicans want to double the cost on these middle-class folks.
And Mark, if I can just, I think your question really raises a fundamental point here, because we're all hearing from people who are saying, well, why don't you just give in? Reopen the government. Give them what they want. But we're all going to pay for those higher premiums. What people don't realize is that we are standing strong, not just on some abstract principle, but for the dollars and cents that everybody will pay in higher premiums. Because if insurance companies don't have the assurance that the sicker people can buy and will buy insurance, they're going to charge more to the healthier people as well. Or the healthier people will go without insurance, which means that everybody gets impacted. So your question is exactly the right question that shows why we are standing strong and not just capitulating to Republicans in the Congress who say, oh, well, reopen the government and then we'll talk. People can't afford to get sick on Donald Trump's timetable. They are making decisions right now in Connecticut and all around the country, and their decisions will determine what the premiums are that we all pay.
So one of the arguments the Republicans put forward against extending all the tax credits is that some people have gamed the system because it became advantageous to put their employees into the market and have them then pay for the premiums through the tax credit. But it's also true that the number of uninsured has dropped significantly as a result of those subsidies. So what I'm asking is, are there any talks that have begun about, is there a middle ground as to how to preserve some of those subsidies for the people who otherwise will become uninsured once again?
Without getting too deeply into the weeds, and again, your question is appropriate. No program is perfect. The Affordable Care Act isn't perfect. There are ways to improve it, but let's make sure that working families have access to health insurance. And the most important point is Obamacare, the Affordable Care Act, is working. More people are insured now. More people are getting health care. More people have the ability to go to sleep at night and know their kids will have dental care or vaccinations or the essential stuff that they need. And there may be people, we're willing to say, for example, no undocumented immigrant should get health care under the ACA. Well, it's already illegal. This is a myth. We're willing to say we'll eliminate rampant fraud, but there's no evidence of rampant fraud. We'll put in a watchdog or whatever to oversee it. We'll go after the people who are trying to game the system. There are all kinds of ways that we could compromise without reducing or diluting or compromising the basic health of our health care insurance subsidy system. And that's why we're fighting so hard. That's why we're not just saying we'll roll over and reopen the government without any commitment from Republicans and from, as I said at the outset, I can't emphasize it enough, without Donald Trump being at the table and making a guarantee.
Senator, as far as the contingency fund, assuming the money's released and SNAP is funded in the next month, when that fund runs out, then how do you propose funding SNAP if the government is not reopened in December?
Here's the thing about the contingency fund. It's only one part of the money available. The contingency fund of $5 or $6 billion won't meet the full $8 or $9 billion for the full month of November, but tariff revenue has been pouring into the Agriculture Department, and it has access to those billions of dollars that can be used to supplement the emergency contingency fund. And the Department of Agriculture has used those tariff revenues in the past for exactly this purpose. We've been through these shutdowns before. There are precedents. This administration is simply weaponizing hunger. It is using pain and inflicting additional pain as a means of political pressure. We haven't seen it before. This SNAP shutdown is unprecedented. In all the shutdowns we've had, and there have been more than a few, never before has SNAP been shut down. This administration is simply using pain as a political weapon.
Attorney General, can you just clarify for me, at the end of the day, you had mentioned that these two federal judges, now last week we had reported that they were saying that this money had to be released. What exactly are they going to tell the USDA they have to release it? Can you clarify?
Yeah, they've already, both courts said that USDA must use the contingency funds. both courts said clearly that USDA has the discretion to use additional funds that Senator Blumenthal detailed. And the Rhode Island court explicitly ordered that to happen for a variety of reasons. The Massachusetts court didn't do what the Rhode Island court did. But both of them ordered USDA to report back today as to what they plan to do with respect to using they have to use the contingency funds, but whether they're going to fill the gap between the 5 or 6 billion or the 8 or 9 billion.
Right, because you mentioned it's short.
Yeah, it's short. And let me just add to what I said earlier. So to clarify, if you have an EBT card in Connecticut, as a general matter, EBT is funded at the beginning of the month. Okay, so SNAP is funded at the beginning of the month, so October was funded. If you had money on your card for October and there is holdover money, you can still use your card. But if you got to Saturday and there was nothing left on your card, there's nothing left on your card. Yeah.
You can still use your card. I think that's an important.
Use their cards, or there's still nothing there?
If it has not been funded and you've exhausted your benefits, then it's empty.
But this is an important point. If you still have money,
Yes.
your card still works.
Yes.
You should use your card if it still has money.
But most people don't have money. It's the end of the month. It's not.
But at the end of the day today, they're supposed to say that whether they'll fund it partially or fully. I mean, do the cards work tomorrow? Is there a timetable?
So my belief, and the attorneys general believe, that they should be able to turn this around quickly. But let me just also say that we expect that there could be some delay, which is an even greater hardship, because if they fund the full amount and just say we're cutting the check, all 8 or 9 billion is covered, we think they should be able to turn that around quickly. What they're saying, however, is if we don't fund the full 8 or 9 billion, then we have to do calculations as to what everybody is going to receive if they're going to receive less. And that could work a delay for people here in Connecticut and across the country.
At the risk of seeming presumptuous, I'm going to say, if the President of the United States says, make those cards work today,
Yes,
it can happen.
immediately.
You know, as the saying goes, if we can put a man on the moon, we can get the EBT cards to work on the same day as the President orders that it be done. And these cards are operating right now with funds that may be left over. It isn't like they've suddenly crashed and burned. The President can make it happen.
In addition to the $6 billion contingency issue, correct me if I'm wrong, is your lawsuit's position that there's also congressional direction to continue fully funding SNAP above and beyond this contingency availability issue?
Well, it's my position that SNAP is mandatory. The question of how it's funded is a related and, at this moment, unresolved question beyond the $6 billion contingency fund.
But the courts,
You could have something that's mandatory and yet not have money for it. But right now, it's both mandatory and they have money for it.
Thank you, everyone.
Thanks.
I got to catch a plane, so I'm out of here.
My middle name. I got to catch a plane.
Thank you for Thank you. Great job. Well done. Thank you.
EY, okay. And Parks.
Well done.
Yes. I had a big.
I'm sorry.